My name is Vilma Diaz. I'm the Director of Latino Affairs with IMHC, and I'm a lifestyle coach and also a master trainer of diabetes prevention program with CDC. And it's a pleasure to talk about diabetes today. That is an illness that impacts our community.
Hi, I'm Renee Rogers. I am the Healthy Lifestyle Manager here at the Indiana Minority Health Coalition. I am also a lifestyle coach for the National Diabetes Prevention Program. I facilitate diabetes and pre-diabetes classes here at the Indiana Minority Health Coalition.
The National Diabetes Prevention Program is a program that CDC created, and they award different organizations such as Black Women Health Imperative. It's a nationwide grant that they got long time ago in 2012, and then they contact different organizations across the country to develop that program. And one of the organizations is Black Women Health Imperative. At the meantime, Black Women Health Imperative contact Indiana Minority Health Coalition here in Indiana. And we, as a coaches, we need to contact the community that suffer this illness, diabetes or prediabetes. And this program, especially National Diabetes Prevention Program, is for that community that is or suffer prediabetes. And as a lifestyle coach, we have a training. And then we need to reach that community that is low income, they don't have insurance, and maybe they don't know how to find help for, diminish that illness as a diabetes or prediabetes. And we put together a plan to serve women's first, Latinas, and African Americans to diminish that illness.
One of the things we also do is we reach out in the community to our federally qualified healthcare systems. Different like Shalom Healthcare, Raphael Healthcare, and we sign an MOU with these communities, and they send us referrals. And those referrals are for pre-diabetic or diabetic patients. When they enter our program, we explain to them that our program is for 16 consecutive weeks. We have 26 curriculums from the CDC that we have to facilitate to our participants. So we start with 16 consecutive weeks, and then after the 16th week, we go from week 17 through 20, we go every other week. And then after that is completed, we do another once a month until we get to the 26th curriculum. It's very important that you stay in the program for 1 year because that it's a behavioral change. It takes time to change your old behaviors.
And you mentioned something, Renee, that is really important with the community or for the community, because it's a year program, but the participant, they don't feel that it's so long because they got involved with us and all the activities that we offer through that year, that they, after a year, they want to come back to us and say, hey, I need help because
When it truly pass.
Exactly. And then we have to, give some tips to them. And if they want it, they can, if we have offered by that time a program, they can join. But we have different groups, but they can join the program as a avian participant, we don't need to report them. And that's the good thing about this program, that maybe they've ended the program, but they can come back to listen, to refresh their mind. Oh, I forgot this, and they stray again into the behavior of that they already changed, but they make few mistakes. It's Thanksgiving.
Think about living, right?
Exactly.
We all live life. We're going to eat that Thanksgiving meal. We're going to eat that birthday cake, and that is okay. What our program does is show you how to eat it and when to eat it, when it's best for you. Just because you get an entire piece of cake, you don't have to eat that entire piece of cake. Sometimes we just need to learn how to cut our portions as well. Portion control is very vital in our class.
Yeah, and then we have so many activities that you guys can enjoy with or without your family. And I would like to mention some kind of challenge that we have when we try to reach that audience that we need to not teach, but encourage them to change their lifestyle.
And sometimes, Verna, I think when we just do what's called our informationals, people just come out and hear what we had to offer. A lot of people never heard of prediabetes. They hear about diabetes, but they've never heard about or were taught about prediabetes, how to prevent diabetes. And so that is so important, to prevent diabetes.
Yeah. Okay.
Some of the tools that we offer also, as Verna spoke about, we offer portion control plates. We offer measuring spoons, measuring cups. And one important thing that I like about the class is that we learn how to read labels. What do you think about reading labels?
Well, reading labels is the hard part for the community, because sometimes they go to, shopping for food, and they don't know what is a portion, what is the ingredients, or what is a sugar portion that meal has. And then we teach them how to read the labels, and also the portion of the food, what they can eat and what they cannot eat. Because some people, they don't know how to prevent diabetes or how to manage diabetes, and that is very important.
And it is. You can have, I'm going to use a honey bun as an example, a honey bun pastry. It's going to tell you, it's one honey bun, but it will tell you, when you learn how to read those labels, how many servings that honey bun is. And that's what you're looking for. How many servings are in what you eat?
Yeah. Also, the physical activity that everybody say, no, I don't need to do any physical activity because at work I walk a lot, or I got, a lot of stairs to go through, or I'm doing picking or doing a lot of stuff. And that is not physical activity, because your brain used to be on that environment or on those, on those activities every single day. And when you do physical activity, like a walk half hour or 10 minutes or 15 minutes every single day, that is a new for you. That is a new activity. If you, for example, go to a ride with your kids or go to a park with your family, that is activities that is different for your brain. And then your brain is going to say, oh, what's going on with this body? And
totally agree.
Yeah. And it's something new, and that is part of the lifestyle change.
Lifestyle change, moving intentionally. Like Verna just said, you go to the park, you walk, you sweep, you mop, you do your chores. That's what you do anyway. Think of it as intentional movement. And it doesn't always have to be jumping jacks, lunges, jogging. It is just moving your body intentionally. So sometimes we just need to sit down and make time to do intentional movement.
And you can play a music and dance. That's a physical activity. You can, mop, or you can, clean your windows. That is physical activity. And then when they listen that, they say, oh, I didn't know that. That worked for me as a part of the physical activity. Yes, because on the beginning, when this program starts, people need to do physical activity, walk, run, and everything. But CDC pay attention to those activities: cut the grass, clean your window, vacuum. All of that is part of the physical activity that you can make it to be part of your, part of this program.
We mentioned the CDC, which stands for the Center of Disease Control.
CDC create National Diabetes Prevention Program, and each organization has the ability to create their own brand. Our own brand is CYL Square. That means change your lifestyle, change your life. And this program is the same thing, but we, or Black Women Health Imperative, adapted cultural across the nation. Why this? We have the opportunity to go to Colombia to train so many coaches over there. And we, thankfully, to CDC, Black Women Health Imperative, and all the organization that is involved with this program, to translate it a cultural tailored program. And that gives the opportunity to go to different places as Asian country that the Black Women Health Imperative go to train some coaches over there. And we, as a IMHC representative, we went to Colombia, South America, to train to around 20 coaches because they saw the needs over there in South America, Colombia. And now we need to talk about, Renee, those barriers that our community, the minority community, have.
Absolutely. And when you look up the barriers, the CDC calls it social determinants of health, right?
Yes.
I'm calling it everyday living for our community.
Yeah.
Because we have food insecurities. We have transportation problems. We had insurance problems. There are things that our community is going through that other communities, the higher up communities, don't have to deal with.
Yeah, and for example, our community here in Indiana, we have some rural part that they are low income and they don't have access to healthcare, access to those many programs that the hospital has, because that involve transportation, money, of course, time, because they have to work. And then we have the opportunity to offer and achieve or meet those needs or those social determinants that the community here in Indiana have. For example, we offer this program to I don't know how many churches we have been offered since 2013. And then we offer in their own language, because that's another barriers that we have in the Latino community. This program in the beginning was for English-speaking community. And then CDC have the opportunity to translate it in Spanish, and we offer to women's first, and then we have men, women, families, churches, schools to offer that program. And then here in Indiana, we have weather that is so difficult. And we go where the community is.
So that means we meet them where they're at.
Exactly.
We meet you where you're at. If you are more comfortable to have a class at your church or your community center or the beauty shop or the barber shop, we come to you. That is one of the things that the lifestyle coaches do.
And also to have those lifestyle coaches that speak your own language. And we have also the opportunity to bring some kind of professional, for example, nutritionists, people that know how to do physical activities so easy for you. And the beauty of this is that last year, for the first time, we offer 2 online or virtual, classes. And that is the best that we have done here in IMHC. Why? Because people they don't have to travel to get the classes. They sit it with their phone, with a computer, and receive the class. And we also meet with them to doing some kind of activity. For example,
shop. Well, are you referring to the online or are you referring
online and also in person?
I prefer the in-person classes because we get to interact with one another, and the group becomes very cohesive with one another when they meet week after week after week. They become friends. They become their own little community. And some of my classes, they walk on Saturdays. They walk on Sundays. They've exchanged information and they get together now and kind of do their own thing. So their physical activity minutes, which the CDC recommends 150 per week, it's over 200 easy because they a lot of people come out of their shells also. I've had a lady in my class before. She was so sweet. She said, honey, I'm here because I don't want to be home with my husband right now. I know. And that was great. But she took the information back home to her husband and her family. So that's what we want to do. If we can reach a family member and that family member takes it back to their house, you can take it to your church because like Verna said, we will come to your church and do an informational.
Yeah, and in person or virtual both work well. For example, when we do the class in person, we also do recipes, easy for you to cook in maximum 15 minutes. We also doing physical activity on the churches that have a gym or a big park area, or and when it's online or virtual, we meet every when we meet virtual after the fourth class, we meet in person to do an activity. It can be physical activity, it can be healthy eating or healthy cooking, or it can be go to the supermarket to shop, and read the labels, or it can be go to a garden and see how to build a garden, or just a walk, in a park or at the canal here in downtown. We can do different activities. That's the beauty of this program, that we also can add activities that the community needed and is no money involved.
Are you saying all these classes are free to the community?
Yes. These classes free.
And that's all they have to do is show up and be a part of for 1 hour a week for 10 weeks for the DS, for the diabetes self-management program, and 1 year for the prevent type 2 diabetes.
And I know people say 1 year, oh my God, this is a lot. It's not a lot. You meet, like Renee explained before, 16 weeks, then for 2 months, twice a month, and then on this months and numbers or weeks, we start meeting one time, or if you want it, you can meet twice a month again, because sometimes people, they need us. They say, no, I cannot do it by myself. How are we gonna meet just 2 or 1 a month?
And you want to hear something great about that, Ms. Birna?
Yes.
We meet with them regardless. We don't say, nope, that program is over, it's done. No, they had our information and they contact us and we meet with them.
And also, we create a group chat. It can be by text message or it can be by WhatsApp, but we send to them tips, recipes, and a lot of things that they need in order to keep straight in the program.
Well, Ms. Barron, I don't like recreating a wheel, so I use the BWHI app. And BWHI means Black Women's Health Imperative. I use their app.
Okay, well,
It's easier for me because it's already done.
yeah, if you speak English, it's an app, is Black Women Health Imperative. You can download, it's free.
It's free.
You don't have to pay. And then in there, you can find a lot of tips, a lot of class recipe, a lot of, webinars. What else?
Just information, recipes, information. But I think one of the things that we're not saying is you become a part of a like-minded community. And when you're around a like-minded group, you tend to stay in there longer. I think it works better for you. That's just me.
And I'm going to share something that is important for the community or the audience that is watching or listening us right now. We have a participant that she lost 42 pounds.
What?
Yes. And we have a winner that she has lost 150 pounds. And that lady, she's only 28 years old, and she say, no, I have to change my lifestyle. And then when you see her transformation, you're going to say, wow, I can do that. And we encourage the community, our community, to enjoy the program,
Yes.
and participate in the program, because this program, maybe you're going to say, oh my God, it's 1 year longer, but it's not. It's easy to attend the class. It's easy. You can do it online. You can do it in person, whatever you prefer.
And we have what's they're called makeup sessions. If you miss a session, don't worry about it. We will come to you and make that session up. We can do it virtual. We can do it by phone. We can meet at Starbucks, and we will make that class up so you don't get behind in the curriculum. But what I also wanted to mention was that is our Prevent T2 classes, which are awesome. But we also have our diabetes self-management program. If you have diabetes, we are here to help you learn how to manage the diabetes. Because if you're not managing your diabetes, it's so many things can happen to you. You can lose a toe, you can lose a foot, you can lose a leg, you can lose your eyesight. Your health depends on what you eat. I'm a big advocate of putting what is healthier inside of me. And I'm not saying I don't eat other stuff, but 90% of the time I'm going to watch what I put inside this vessel, because it's the only vessel that I have. And I'm aging every day. Thank you, Jesus. I want to still be able to put my own clothes on, comb my own hair, bathe my own body. That's very important to me. We all have a why. What is your why? And when you ask yourself, what is your why? Why do you want to be the healthiest you can possibly be? Answer yourself. Give us a call. Contact us. And we understand that life happens, and we want you to be in the class when you are supposed to be in the class. But again, we understand that life happens. If for some reason your life happens, we will make allowances to make up that session with you at your convenience before the second.
We can run it back. That's cool.
We understand that life happens. And when it does happen, we are here to meet your needs. We will meet you.
Your phone? The change
Everywhere. Coffee shop.
I can't even get that far, Venom. Okay. Go out. Well, I can't even get that far. Okay. We understand that life does happen. And when that happens, contact your lifestyle coach to let them know in advance if possible. But we need to meet with you prior to the next session so you can get your curriculum. Okay?
Those meetings or those, I would say makeup section, but it's not like that. It's like you can get into, updated to get to the other class. It's like a makeup section, but, we know, like Renee said, life happened, and maybe you have a school meetings with and you are not able to come to the class. But next day, you called your lifestyle coach and say, hey, I missed the class because this, or, you got COVID or you got flu or whatever. And then you call your lifestyle coach and say, hey, I missed the class. I need to recover that class. And we, as a life coach, we can meet FaceTime. We can meet by video camera or video section. We can meet in a coffee shop. What else we can meet?
The park.
The park. What else?
We can always meet here at the Indiana Minority Health Coalition.
Yeah, and update you to that section to get ready to the next section.
Absolutely. I would like to share one of my participants' success stories. He's a well-known pastor here in Indianapolis. Shouts out to Pastor Green. He was one of my participants, and he told me he would eat Hardee's every morning for breakfast. And he and his wife were in my program, which I thought that was very important because he is a pastor of a church. So his congregation was on board. So it was a very successful year. But his story was his A1C was, I think it was 6.2, if I'm not mistaken. So he was very, very close. But after being a part of the class, he lowered his A1C 5.5. And he looks amazing. He said he feels amazing. He literally looks different, guys. When you lower your A1C and your cholesterol and your overall, you look different. You look more vibrant. So that's one of the pluses of being in the program.
And you mentioned something important that people need to know. When you go to the doctor, just ask for the A1C test. The A1C test is the one that see your glucose from today to 3 months prior. And that test or that screening or exam, they can, that A1C can tell you if you are diabetes, pre-diabetes, or you are normal levels of the A1C. And that is the most important screening or exam that you need to get it when you go to the doctor. And if your level is 5.6 to 6.4, I believe, if I'm correct, you are in the levels of pre-diabetes. If you are 6.8 and above, you are diabetes. And then we have, when we have health fairs, we provide that A1C testing with glucose, cholesterol, etc. And some people, when the nurse did the A1C, some people has the A1C on 9, on 13 level, and that is huge. It's like you are you are on a step to get insulin, and you don't need that. When you got insulin or when you use insulin, is that you need to take care your body and your diabetes harder, because it's like you need to injection in your body to get those blood sugar levels on place, and we don't need that. And with these classes, the diabetes self-management that Renee mentioned, or the diabetes prevention program, you can control or prevent diabetes. That is a huge illness that our community is not only
Black community, Hispanic,
the Hispanic,
it's the whites as well.
it is Asian, the Asian, but we need to take in care. Do you know, guys, that diabetes costs more than $12,000 per year? And that includes medicine, the doctor cost. If you don't have insurance, it's even higher. And then people that use insulin, people that take more than one medicine, that is a lot of money that you need to take in care through the years. And then if you don't take control of your life, don't prevent your any illness, not only diabetes, high blood pressure, or cancer, is hard and it's cost more money. And, it's like if you don't have insurance, or if you have insurance, it's money that you need to pay for.
So it takes us back to social determinants of health. You have so many different things that impact the communities and their health, right? You mentioned, Verna, that when you go to the doctor, everybody doesn't go to the doctor.
No.
And nowadays you go to the doctor only has about 7 to 10 minutes to talk to you. So they may not have time to talk about your A1C because they may be talking about your heart, or they may be talking about something else. Now, it's all important, and I totally agree with you. But then you had also the biases of the physician.
Yeah.
We know that does happen, unfortunately. If you look a certain way, you're going to get treated a certain way. And I feel like that's one of the reasons why a lot of our community do not go to the doctor. One, they can't afford it. They don't have insurance. Two, they're going to get treated differently.
Yeah.
And it does happen. So those are some things that I know we can talk about it all day, all night, but what can we do about it?
Mm-hmm.
So it has to go higher and higher to different levels. I would love to see everyone on insurance.
And that's the reason we, as a person, as a community leaders, we need to have those kind of this program to prevent and help the community. And also, my advice for the participants or for the community in general is to be on top of your health. It's one day a year that you need to go to the doctor. It's so many free clinics here in Indiana that you can go. You don't have to pay any penny to go and see how is your health. Go to those health fairs where you can be testing or get a screening, free screening, where you can see your sugar level, your high blood pressure, your cholesterol, your A1C, your BMI.
She said possible participants out there and watching or hearing us, she said free. Verna said free. There are so many free health fairs that go on in Indianapolis. in the inner city all by itself. Not talking about the outskirts, just the inner city. They provide, like Shibirna said, your A1C, your cholesterol, different things like that. You can get that for free.
Mm-hmm.
And then there's also services that are provided that can give you information about doctors.
Exactly.
So you can get not really a wraparound service from us, but you can get the information that's needed from us. And everything that we do is of no charge to you. So why would you not want to participate?
Yeah. And I invite everybody to visit the website of Indiana Minority Health Coalition, the Facebook, the Instagram. It's www.imhc.org. You can visit and get more information about any program that you want to participate, but also the diabetes prevention program and the diabetes self-management program. Is resources that we have, and we have so many coaches that can help you to prevent or control your illness. One thing that we want to mention here, Renee, is trust and collaboration. We collaborate with so many organizations. You mentioned Shalom. I would like to mention IU Health because they have a free clinic where people, when they are diabetics or pre-diabetic or high blood pressure, we can refer them to those free clinics. And trust is another thing that we try to those participants to first trust us as a lifestyle coaches, and also those topics that we offer to them, they understand, and also how they feel when they go to your class.
I'm so glad that you mentioned topics. What are some of, we have 26 sessions that we have to facilitate. Our topics range from emotional eating, depression, lack of exercise. So we talk about what is very relevant in our lives today, right? And it makes it more organic.
Okay.
For the class.
And how they feel. Do you think that they feel safe? Do you think that if they come to our class, they feel comfortable, safe, and trust with us?
I think it is up to the lifestyle coach. Well, I know it is up to the lifestyle coach to set that tone. So being a lifestyle coach, it's just not going in and it's not reading the curriculum. You have to set that tone of your class. And you want to go in and set it on a professional level, but you also want to be very humble. You don't want to speak down to anyone. You want to just you want to be a part of.
Exactly.
So when you show them that you got challenges yourself, I do. And if they ask me, I share my challenges with my class because I'm just as human and I go through it. And there are sometimes I still call another coach and get advice from. Yeah. So I think that's where that trust comes in, when they see that you're just a human, vulnerable, just like they are.
Yeah, and also the place where we have the classes. We need to offer a safe space where they can feel welcome, where they can feel safe. That's the reason we choose churches, community centers, and also here at the office, because we have a wonderful big conference room where we can offer the class.
And a large parking lot, well-lit parking lot. Those things are so important.
Oh, yeah. And also the bus.
On the bus route, you're right, for people who don't have transportation. But there are so many things that we do outside of the scope of a lifestyle coach for our participants. Yeah. Do you ever have some of your participants call you on the weekends?
Yes. And it's not a bad thing, but we have participant text message or call because they need their help, our folk.
Yeah.
And they call us, hey, I prepare, or send pictures. They send pictures about they change a habit, eating habit, because sometimes they used to eat rice and chicken and I don't know, maybe plantains, fried plantains. And then when they change those habits, they send salad and a protein portion, chicken, beef, or fish. And then that is a beauty of that. And also, Renee, we are almost finished this podcast. And what class are you going to offer this coming fall?
Thank you. Verna asked about my class that I'm going to be starting. I am going to have a new diabetes self-management support program class that's going to be starting on tomorrow, Thursday, and it is going to be virtual. So it's virtual to start, not the entire class. Please contact me at r.rogers@imhc.org for more information, or feel free to call me 317-920-4915. And I will be more than happy to give you all this wonderful information about this new diabetes class. It's only 10 weeks, so you do have time to come out, but call me.
And what we're going to offer in that class? What is the good thing about the diabetes self-management program?
Oh, thank you, Verna. We are going to offer at no charge to you a Dexcom CGM, a continual glucose monitor.
And you're going to learn when you get your monitor, your continuous monitor, you're going to see how your sugar level going up and down when you eat.
That's at real time?
Yes, in real time. And then when you eat that cake or that ice cream, you're going to see how those level going up. Or when you do physical activity, it's going down. Or when you eat the healthy plates, with a portion of protein and vegetable or salad, you're going to see how your sugar level are going to be stable. Are going to be on, those levels that everybody love it. And for a diabetes person, A1C with 7, the number 7 is perfect. It's when you control that diabetes and you are the king or the queen of controlled diabetes.
You know what we forgot to mention, Verna?
Well,
that pre-diabetes, in some cases, can be reversed.
Oh, yeah.
So when you are pre-diabetic, in some cases, it can be reversed. You do not have to deal with this demon. Yeah. But with the diabetes, it's okay. You can learn to manage it. And that's what's important. You learn to manage your diabetes. You learn your body. You be in control of you. Prepare your own food. I like to eat, but I'm going to X out fast foods. You don't know how they prepare those fast foods.
Oh, yeah. And also, I want to share that we're going to start a National Diabetes Prevention Program, CYL Square, on the last week of October. We're going to have it online because, winter is coming and we want to keep you safe at home. And we're going to have 2 classes, one in the morning and one in the afternoon. Just call us here in IMHC. You can call me or text me to my cell phone. It's okay. Don't worry about it. It's 317-504-7893. And you can text me and say, hey, I want to participate on the National Diabetes Prevention Program or CYL Square. It's free. It's going to be in Spanish. It's going to be at the end of the last week of October.
Nice.
Yeah, because we already started diabetes self-management.
Yes. One of the things I would like to leave the possible participants with is trust this process. This is an evidence-based program. It's been around for a while. The numbers don't lie. The participants don't lie. The testimonials don't lie. The people don't lie. We see this firsthand. Trust the process. Call me 317-920-4915. Email me r.rogers@imhc.org. Go to our website, www.imhc.org.
This program works if you want to control your health and your life. It's okay to not be okay, but you need to be positive that you're going to change your lifestyle. And we are here to help you. We are here to support you. We are here to guide you. We are here in this journey with you. You need to trust the program. You need to trust everybody else. You need to trust that you are in control of your health and your life. If you need more information, you can visit Indiana Minority Health Coalition website, that is www.imhc.org, or you can call here. The phone number is 317-926-1126, or you can text me at 317-504-7893. I'm able to text you back if you wanted to participate on the English program or the Spanish-speaking program. Any of that, just text diabetes or pre-diabetes, and we refer you to the one that is according to your needs.
And you know what else? If you didn't get in those pants that you're wanting to get into this summer, join our program. You got an opportunity next summer.